Hello everybody, and I welcome you again in my channel Dr.Tuti. This is the third presentation of a topic, cornea as a refractive medium. Let me just briefly remind me what we had in the first part and in the second part. First part was about the cornea as itself, the general information about histology, some corneal parameters as optic and refractive parameters, then a little bit about aberration and biomechanics. The second part was about the examinations. We just started to talk about corneal examinations, which are keratometry, topography, tomography, and now we're going to continue with examinations in our third part. Let me just remind you that this topic is in general a compact information about the cornea as a refractive medium, which means that what kind of information we have to pay attention on when we consider cornea for any of refractive surgeries. So let's get started. We begin with elevation corneal topography. So as we already discussed, every method has advantages and some limitations. The main advantage of this examination that it defines the corneal abnormalities, location and extension. It's very easy to guide with this examination a LASIK surgery. It provides with asphericity measurements, and elevation map also can calculate the refractive map. So the limitation is that this method actually doesn't provide the real-time measurements. It doesn't give such an accurate pachymetry measurements pre and post-operatively because the ultrasound method of measurement corneal thickness is more precise for nowadays, and still it is, and the posterior measurement is not accurate anymore as it was considered previously. But what we have to know about this examination, that there are main parameters which are Rayo index and Tonable index. So about Rayo index, the normal measurements of this index is that first of all, it's an index from the posterior elevation map, and it shouldn't be more than 40 microns. So when it's less than 40 microns, it's considered normal. For another Tonable index, we can say that this is from anterior elevation map, and the normal range are within 20 microns. And just in general, clinically, what it's good to know, as we can see, for example, in this slide, the central part of an image includes only 3 colors. So when it's just 3 colors or 2 colors, or it means that the cornea is normal. So this is like a first image estimation, yeah. And additionally, elevation corneal map topography, includes 24 additional parameters, but all those parameters are not clinically estimated. That's why we don't use it in a practice, and they're not proved. Also, what we have to know, for example, in this slide, I showed you that elevation corneal topography, it gives the information by slit transversal scanning and slit rotative scanning. Basically, all this information is about best fit sphere, which is very important for the indications or contraindications for the future refractive surgery. Corneal refractive surgery, of course. Yeah, and let's talk about corneal aberrometry. So as we talked already in the first part of this presentation, as we talked already about the aberrations, so basically aberrometry measures aberrations. So corneal aberrometry using a Wavefront sensor, which allows us to analyze aberrations in the wavefront of light passing through the optical system. Here in this slide, it shows us how to analyze the wavefront. Aberrometry is used to determine wavefront errors of light passing through the eye, and these errors are described by Zernike polynomials. So there are orders of aberrations from low to higher. The low order aberrations begin from 0 I wrote from 1, but it's also okay, from 0 to the infinity. But clinically, we only talk about the 4 order aberrations, because more than this clinically is not describable, let's say like that, and it's not useful for a clinician. So here in this slide, for example, we can see the aberrations from 0 to the second orders, and this describes the spheral cylindrical defocus. The third order describes coma, tilt, and trefoil, and the fourth order describes spherical aberration, which affects visual quality. In this slide, for example, you will have a question like, what is that? Is it also a Zernike? So no, we have to distinguish and to know that wavefront deformation is presented by Zernike polynomials, but the analysis is actually performed by using Fourier decomposition. So this is how we estimate the aberration, by this image. Then, so the main parameters of aberrometry, what we have to pay attention on is Zernike polynomials, root mean square, the point sprint fraction, and modulation transfer fraction. This is what we have to remember, because all these parameters we're going to discuss in our future presentation when we will be discussing aberrations more detailed. Next examination is optical coherence tomography. Optical coherence tomography provides the information about the cross-sectional image of the cornea. As we can see in this slide, this is a normal picture over normal cornea. So what are advantages and limitations? First of all, this method allows us to zoom in on the cornea, and it provides an accurate pachymetry map. And the limitations, it cannot pass through the pigmented iris. I don't really think that we need to know that much what happens after the pigmented iris for the LASIK refractive surgery, but yeah, this is one of those limitations which this examination is not providing us. And next, so cases when we need OCT for cornea is to monitor the shape of the cornea and the health after corneal refractive surgery. So by this method we can estimate the wound healing, we can estimate the situation of the graft after keratoplasty surgery, for example, and then we can estimate corneal incisions and just see the situation of the cornea in the patient who is using contact lenses. And here in this slide and the future slides, I'm just gonna give you a few samples cases of the patients. For example, in this slide, the top image is the patient 1 week after LASIK surgery. So I will just tell you, maybe it's not really visible, but I think you can see the line in the cornea. So this is a line of the flap. And the depth of this flap is 109, 115 microns. Below, we can see the image of the same cornea, but 2 weeks after LASIK surgery. So what we have to pay attention on, there is a gap filled with epithelium, which is visualized between the temporal edge of the flap and the stromal bed edge. So the width of the gap was measured with computer and caliper, and it's 364 microns. So with this method, the advantage of this method that we can clearly see this and check it in the future, like controlling this condition. Yes, and the next case, for example, is a patient after photorefractive keratectomy enhancement, and after the surgery, this patient has visual acuity 20/50, and of course is not really happy because additionally this patient has haze, and the quality of vision is not really good, and so but OCT examination showed us that the central corneal thickness was 344 microns, and while the depth of the opacity was determined to be 127 microns. So as we can already estimate, there is not enough stromal bed thickness for a phototherapeutic keratectomy to remove the haze. That's why what we have to do in this case, for this patient was prescribed corticosteroids treatment, and after 6 months the visual acuity was improved to 20/20. So this is just another sample of OCT image, and as you can see, it's really nice to control the healing process and to see a condition of the cornea after refractive surgery or any other surgeries which include the cornea. Next, and this is a pachymetry map which I told you. This is just a sample of an image, and in this slide, for example, you can see the parameters and the points which give us the information when we have to worry about the parameters and about the thickness, and when we have to pay attention on all these measurements and consider any abnormalities on the surface of the cornea. For example, there is basically everything about thickness. So when the difference between minimum and medium corneal thickness is less than -33 microns, when the difference between inferior and superior part of the cornea is less than -31 microns, when the difference between inferior temporal and superior nasal less than -48 microns, when the thinnest corneal thickness is less than 492 microns, and when the thinnest region of the cornea is outside of the central 2 millimeters area. So I think this slide is very good to remember, or just, I don't know, to print it or hang it somewhere. So it will be very helpful to analyze and to pay attention on all these parameters when you have a patient, when you suspect about any keratoconus conditions. So combination of these measurements with the parameters of other examinations, I think it's going to be a very good tool for a right diagnosis. That's basically it about cornea as a refractive medium. I think it was helpful and useful information for you. As I told already, this is a compact information of everything we have to pay attention on when we consider cornea for refractive surgery. Thank you for your attention. Hope to see you again on my next videos. I will keep you updated. Have a good day. Bye.